Thank you for joining the 2021 Benefits Open Enrollment Virtual Employee Meeting. My name is Dave Blazewitz and I'm the City of Tampa Benefits Manager. Our benefits team, along with the many valued benefit partners such as UNITEDHEALTHCARE, CAREATC, and others, have developed this presentation to provide you and your families with the information you need as you elect benefit coverage for the 2022 plan year. Open enrollment begins Thursday, September 30th and ends the evening of Wednesday, October 13th. As in the past, you will make your enrollment selections in Oracle Employee Self-Service. Your current coverage elections will carry over for 2022 with the exception of Flexible Spending Account, or FSA, participation. You must enroll in FSA each year during open enrollment in order to participate. If you are changing medical plans or dental plans, adding or removing a dependent from any plan, or desiring to change your life insurance or long-term disability insurance coverage, you make that change in Oracle Employee Self-Service. Later, our benefit partners will provide you key information about their respective programs. To better organize the presentation, we have broken it into 4 sections as shown here. At the end of the presentation, you'll be provided information on where to direct any questions. One of the advantages of this virtual presentation is that you can stop the presentation at any time to jot down notes or questions you may need to ask, and then resume. We hope you find the presentation helpful. For 2022, both medical plans, the City Plan with HRA and the Simple Wellness Plan, are unchanged from the current year. Each of the plans has the same co-payments, deductibles, and maximum out-of-pocket limits. Both have the same network of UnitedHealthCare providers, and both have the same covered services. The biggest difference is in how your claims costs are shared with you and how any wellness incentive amounts you earn are applied. UnitedHealthCare will provide more information in a moment. Please be aware that employee contributions from your paycheck will increase 7% in 2022, solely due to the rising costs of underlying medical conditions and drugs. Both medical plans offer wellness incentives to lower your claims costs in 2022. Incentives you earn this year, 2021, can only be used in 2022. For the City Plan with HRA, both you and your covered spouse or domestic partner can each earn up to $1,000 placed in an HRA account, up to $2,000 per family. The amount in your HRA is used for all covered family members' expenses that apply towards your deductibles. If you participate in a Simple Wellness Plan, only the employee's completed wellness incentive activities provide a reward up to $1,000 in 2022. However, the amount you earn is available for each and every covered family member during the year to lower certain claims costs. Now you'll hear from our health plan related benefit partners, UnitedHealthCare and CAREATC.
Welcome to the City of Tampa's UnitedHealthCare benefits for calendar year 2022. Thank you for taking the time to review your 2022 medical plan options, which also includes prescription drug coverage. There are no changes to either of the plans from 2021. In the next few slides, I will review the deductible, out-of-pocket, co-pays, and co-insurance on both plans. I'll also take a few moments to review the flexible spending account, and we will hear from your UnitedHealthCare on-site team, who will review all of the resources available to City of Tampa employees. This slide shows a side-by-side comparison of the 2 medical plans offered to City of Tampa employees. The first plan is the City Plan with HRA, the middle column, and the column to the right is the Simple Wellness Plan. In the first column of this slide, we've highlighted the most commonly utilized benefits. The calendar year deductible is the amount you have to pay or meet before the insurance begins to pay for major medical services. For an individual, that is $2,000. For a family, it is $4,000. The deductible is the same for both medical plans. Next is the out-of-pocket maximum. It's $4,000 for an individual or $8,000 for a family for both medical plans. The out of pocket is worst case scenario in a given calendar year and shows what you have to pay out of your pocket before insurance pays the rest. Next is office visits. As a reminder, the Wellness Center is a $0 copay, so please take advantage of those whenever possible. Next are virtual visits, which are a $15 copay and are available either via myuhc.com or via the United Healthcare app. PCP is a primary care physician and is a $30 copay. A specialist visit can be a $30 copay if you use a Tier 1 specialist. You can check to see who is a Tier 1 specialist by performing a provider search on myuhc.com or on the United Healthcare app. All other specialists have a $50 copay. Please note office visits are not subject to the deductible. You are simply paying a copay. Preventive care is covered 100% under both plans. Your preventative care is your annual routine adult physical, as well as adult and child immunizations and age appropriate tests, such as mammograms, colonoscopies, etc. Next is emergency room. On the city plan with HRA, you have a $300 copay. On the simple wellness plan, you are subject to the $2,000 individual deductible first and then have a $300 copay. An alternative to the emergency room, if possible, is an urgent care facility. For both plans, you will have a $50 copay at an urgent care facility. You're also able to use mini clinics that are located in a CVS or Walgreens. They can take care of non emergency issues such as pink eye, earaches, and allergies, and are usually run by nurse practitioners. A visit to a mini clinic is a PCP copay of $30 for both medical plans. For the city plan with HRA, outpatient surgeries, hospitalizations, or inpatient hospitalizations are subject to the individual deductible, and then you pay 10% while the plan pays 90% until you reach the out of pocket maximum. On the simple wellness plan for outpatient surgery tied to a hospital, you will have a $250 copay after you've met the $2,000 individual deductible. If it's a freestanding outpatient facility not affiliated with a hospital, you will only pay a $100 copay. For inpatient hospitalization on the simple wellness plan, you will be subject to the deductible first, and then you will pay $400 a day up to 5 days maximum. Your prescription drug benefits are the same for both the city plan with HRA and the simple wellness plan. Remember, the Wellness Center also has a list of maintenance medications that you can take advantage of for a $0 copay. There are 4 different tiers into which your medications will fall. Tier 1 is for generic medications and has a $30 copay. Tier 2 is a $60 copay. Tier 3 are brand medications with a $90 copay, and Tier 4 is where most specialty medications will fall. For a Tier 4 medication, you will pay 25% of the cost, and the city will pay the remaining 75%. The percentage you pay, along with the copays, will apply to your out of pocket maximum, which is $4,000 for an individual or $8,000 for a family. There is a mail order program available through OptumRx where you pay 2 times the applicable copay for a 3-month supply of medication. As a reminder, the City of Tampa does have a mandatory generic program. This means if there is a generic equivalent medication available and the member chooses the brand medication, they will not only be responsible for the applicable copay, but also for the difference in cost between the brand and the generic drug. I'd like to take a few moments to explain the city plan with HRA and how that HRA or health reimbursement account works in favor of the employee. The city funds the health reimbursement account depending on the incentive steps an employee completes. You can earn up to $1,000 for an individual and an additional $1,000 for a spouse. When a claim comes into United Healthcare, we will automatically take any deductible or coinsurance out of that health reimbursement account first, the city dollars, and then you will be responsible for the remaining portion of your deductible, and the city will pay 90% of the bill, with you paying the remaining 10% until you reach that out of pocket maximum. There are two types of flexible spending accounts, a healthcare FSA and a dependent care FSA. You can elect to set aside money on a tax-free basis into these flexible spending accounts to pay for eligible medical and dependent care expenses. Both the IRS and employer can limit the amount you can contribute. You must also re-enroll in the flexible spending account every year if you'd like to have one for that plan year. The first type of flexible spending account is a healthcare FSA. For 2022, you can set aside up to 2,750 pre-tax dollars to pay for qualified medical, dental, and vision expenses such as doctor's visits, copays, prescription eyeglasses, contact lenses, dental exams, cleanings, and over-the-counter medications, just to name a few. Please keep in mind over the counter medications do require a valid prescription from your provider if you're going to use your healthcare FSA to pay for them. Please note the healthcare FSA has a grace period through March 15th of the next calendar year. Active employees have until March 15th of the following plan year to incur medical expenses and until March 30th to submit claims. Your healthcare flexible spending account comes with a healthcare spending card, which is a MasterCard to make paying for your eligible medical, dental, vision, and pharmacy expenses easier. No reimbursement forms need to be submitted, and most grocery stores and pharmacies won't have any issue identifying eligible expenses. The second type of flexible spending account is a dependent care FSA. In 2022, you can set aside up to 5,000 pre-tax dollars for your dependent care needs. This includes before and after school programs for eligible children, childcare, nursery school, preschool, adult and elder care, and travel costs to and from eligible care if provided by your care provider. Please note you cannot carry over any unused dollars. If you don't use all of the funds in the dependent care FSA, you will lose them, so please be sure you plan accordingly. I will now turn it over to Debbie Johns, the UnitedHealthCare On-Site Nurse Liaison.
Hi, my name is Debbie Johns, and I'm your United Healthcare On-Site Nurse Liaison, dedicated to serving the City of Tampa. I've been a registered nurse for over 25 years with a diverse clinical background, specializing primarily in case management and disease management. As your nurse liaison, my overall focus will be to provide you with the tools, education, and resources that will help you manage any health issues and stay as healthy as possible. Here are some of the ways I can help you. I can provide health education classes and programs to promote optimal health, manage chronic conditions such as diabetes, hypertension, asthma, and heart disease. I can identify condition-specific support programs, benefits, and other resources. I can help you choose the appropriate medical care, including finding a primary care provider or a specialist. I can provide guidance in understanding your treatment plan and assist you in communicating more effectively with your healthcare provider. For example, I can help you develop a list of questions to ask your provider in order to clarify treatment plans, medications, and health goals. I also provide prevention education and health screening information, and I can help you monitor your blood pressure, blood sugar, weight, and body percentage. Please be assured your individual health information will be kept confidential and protected in accordance with HIPAA and will not be shared with the City of Tampa. Only aggregate program data will be shared with the city. I am super passionate about promoting health and wellness, and I'm very excited to partner with the employees and retirees and families of the City of Tampa. Give me a call, text, or email me today and let me know how I can support you. Thank you.
Hi, I'm Beth Granger, your dedicated health coach for the City of Tampa. And I've been in the wellness field for over 20 years and part of the United Healthcare on-site team for the city since April of 2020. My coaching services are free for all members on the United Healthcare plan. So what exactly does a health coach do? I'm here to help in a variety of ways, including provide details on how to navigate the City of Tampa wellness tools and resources, assist you to understand your modifiable health risks, coach you to develop and reach personal and healthy lifestyle goals, share information on health screenings and wellness education, and identify and recommend appropriate wellness and condition-specific programs. So if you have a healthy lifestyle goal, such as weight management, increasing your physical activity, nutrition changes, life balance, or disease prevention, as your health coach, I can help you develop goals to improve your health and well-being and provide the tools and the resources to support you in this process. So please reach out to schedule a session, and I look forward to supporting you in your wellness journey.
Hi, I'm Bryant, your UnitedHealthCare on-site representative. I've been with UnitedHealthCare for 10 years, and in that time I have learned quite a bit about health insurance. My goal is to help you understand how your plan works and that it is working as it should. As your on-site representative, I can assist you with understanding your health benefits and out-of-pocket costs. We can discuss your health incentives and how they may contribute to upcoming procedures. So if you have questions about your UnitedHealthCare health plan, please call or email me. Thank you.
Hello, my name is Lizette Soto. I'm with CAREATC as the client ambassador. We sponsor your employee wellness centers. A little bit about CAREATC. We have no-cost primary care in person or virtually for participants ages 2 and up. We provide 24/7 scheduling through the patient portal and CAREATC mobile app. Our goal is to provide more face-to-face time with you and your providers. We do not bill your insurance, and we are 100% confidential and HIPAA compliant. We will not share any information with the City of Tampa. We provide free on-site lab testing and select generic medications. We have a range of services we offer, from preventative care, illness, injury, and chronic disease management. Who is eligible to use the wellness centers? Employees, spouse, and dependents. Employees must be enrolled in the medical plan. Dependents include spouses and children ages 2 and up. Some of the treatment and services that we include, as I said before, are primary care services and chronic disease management. We can manage anything from diabetes, asthma, high blood pressure, high cholesterol, to some of the lesser things of allergies, acute care needs, and general well-being. We do provide physicals with the providers, as well as you can bring your children in for sports physicals. We do offer tobacco cessation programs, and we also do vaccinations and labs in the Wellness Center. CAREATC has 3 easy ways to schedule. You can call the 1-800 number or use your desktop computer to go to careatc.com/patients. We also have the CAREATC mobile app. The CAREATC mobile app and the patient portal are very similar, just in difference of using your computer or your smartphone. You can schedule 24/7 appointments using both the patient portal and the mobile app. You have access to provider messaging, medical records, prescription refills, health assessment results, health education libraries, and directions to your nearest wellness center. CAREATC provides an annual PHA. As many of you know, this is part of one of your requirements for your incentives. You can view your results either on the mobile app, or you will be sent a summary in the mail. Your PHA detailed lab results will track you from abnormal to healthy to high risk. You can also view digital results in the CAREATC portal, and it will go through your labs in a summary of a video. CAREATC sponsors Health Passport, which many of you may know that you use to track your incentives. Be sure to check your completion of your incentive steps, your PHA draw, tobacco certification, and webinars. Please remember to participate in fitness challenges. as well as using the references in the health education library. A few wellness center reminders. Prescription refills take 24 to 48 hours if being filled in the office. Most refills are sent to Northwind. We do offer extended hours until 7 p.m. several days a week and offer Saturday hours from 8 to 12 at both the Himes and Brandon location. Please be aware that there is a no-show policy. 3 no-shows will result in suspension of the use of the Wellness Center for 30 days. Thank you.
Next up are our voluntary benefit partners, Humana Dental, Superior Vision, EFP Elective Benefits, and the UnitedHealthCare FSA, which we've already heard from.
Hello, city employees. My name is Belinda Gonzalez with Humana, and I am pleased to be here this year and share with you that there will be no plan changes or rate changes for 2022. As Dave mentioned earlier, thank you. As Dave mentioned earlier, this is your open enrollment period where it's time to review your dental needs for the upcoming year and make any changes. Remember to utilize the Humana website or mobile app to find your plan benefits. Obtain a copy of your explanation of benefits, search for a new provider, or view and print your new dental card. There are a few reminders I'd like to go over with the DHMO dental plan. Again, the city is going to offer you the 2 different dental plans this year. And some reminders about the DHMO plan is that it is in-network coverage only. You must select a primary care dentist to be assigned. You can change this dentist by contacting customer service, and you can do this by the 15th of each month. This plan has no deductible or annual maximums. You just pay the co-payments for the procedures listed on the schedule of benefits. The full schedule of benefits can be found on the internet for the city site. This plan does have orthodontic coverage for both children and adults. The PPO dental plan is a nationwide network of dentists, and you can go to any dentist of your choice. You have a greater savings, however, if you do stay within the network because there will be no balance building. If your dentist is in the network, you would be responsible for any balance if the dentist fees are over the reasonable and customary fees. This plan pays on a co-insurance level and does have an annual deductible that applies to basic and major services. We suggest that any treatment over $300 that your dentist file and submit a predetermination so you're aware of any financial responsibility. This plan does have exclusions and limitations, so this will also help with the predetermination. This plan does have orthodontic coverage as well, but only for children through the age of 18. Thank you so much for your time.
Welcome. My name is Agnes with Superior Vision. Thank you for joining the City of Tampa open enrollment for the year 2022. This year, there will be no plan or rate changes on your vision plan. As a Superior Vision member, you enjoy in-network benefits available through Network Eye Care Professionals. You can find an in-network provider at superiorvision.com, or you can call your eye doctor to verify network participation. You can obtain a vision exam with either an MD or an OD. You may use different eye care professionals for exam and eyewear, and newly enrolled members receive a personalized ID card in the mail. And you can now also access your benefits through our mobile app, where you can display your member ID card, view benefits, and locate a nearby provider. Your benefits include a comprehensive eye exam every 12 months, paid in full. Contact lens fitting, standard or specialty after $30 copay. Frames and lenses every 12 months. Covered lenses are paid in full after $15 copay. Your covered lenses are single vision, bifocal, and trifocal, standard progressive, cover at trifocal level, polycarbonate covered in full up to age 19, and tinted lenses. Your frames and contact allowance is $150 every 12 months. Keep in mind that contact lenses are in lieu of frames. Medically necessary contact lenses are covered in full. Our network is built to support our members. We manage one of the largest eye care professional networks in the country with over 1,985 access points and 50 of the top 50 national retail stores such as Costco, Sam's Club, VisionWorks, Walmart, America's Best, Target, LensCrafters, and many more. You also benefit of our online retail providers. Currently, we have 4 online retail providers: 1-800-CONTACT, BeFitting, Contacts Direct, and Glasses.com. You can visit www.superiorvision.com to locate an eye care professional. Some of our additional benefits and discounts to our members are LASIK and your hearing network. As a Superior Vision member, you receive preferred pricing on LASIK through QualSight. Free LASIK consultation in over 900 locations nationwide to choose from. For more information on LASIK, visit superiorvision.com/members/LASIK or call 1-877-718-7661. Your hearing network. Through your hearing network, you are eligible for a free eye exam, a 60-day trial, money-back guarantee, and follow-up care for 1 year. And you can also find more information on hearing aid and discounts by visiting our superiorvision.com, yourhearing.com website, or call 1-888-494-1272. And if you have any questions, you can find us online at superiorvision.com, or you can call your concierge line at 1-844-549-2603. Thank you.
Employee Family Protection is here again to help with employee benefits. The enrollment period is September 30th to October 13th, and counselors will be available from October 1st, Friday, October 1st to Tuesday, October 12th to help educate and enroll in employee benefits. So you can call a benefit counselor for an appointment today at 844-231-1623. We have the benefit meetings available both in person and on the phone. I have 6 benefits to talk about today, and 2 of them have new features. One is completely new. So the first one that's new is short-term disability insurance. Short-term disability can replace up to 60% of your monthly income if you have a covered disability that keeps you from working. This year, there are 2 new features on the short-term disability. It's for mental illness, certain mental illnesses, or substance abuse treatment. So you can either elect to get in the new plan and have those features as part of the plan, and if you do that, it will be guaranteed issue. Or you can keep your existing plan if you have one, and you can even make increases to your existing plan. And the way short-term disability works, it can replace up to 60% of your paycheck while you recover for 6 months. At 6 months, that's when that long-term disability you'll hear about kicks in. And you can use this benefit to help you meet out-of-pocket expenses. The next new plan is called Cancer Guardian. And this is a new plan that benefits you with comprehensive support services, DNA testing, and technology. And essentially, it has benefits for you from the very first day. So that means that you can get a genetic test done, which means you spit in a tube and they take a look at your genetic makeup, and they see if you have any markers that suggest that you will have cancer, and you can actually take preventive measures in order to help you with cancer detection early, like more frequent or earlier tests for things like colon cancer or breast cancer. So there's preventive things. If you do end up one day with a cancer diagnosis, you have support specialists to help answer questions and experts to review your diagnosis and even help find financial assistance for you. And there's much more to this plan as well. So this one has benefits from from the first day all the way through, and even someone who's already had a diagnosis would be able to get discounted rates. So there's a great deal to this benefit, and it's exciting and new for 2022 for City of Tampa employees. And the next slide. Universal life insurance can pay money to your family if you die. It can help with basic living expenses, final arrangements, tuition, and long-term care. So that means it has both living benefits and death benefits. So there's money for you while you're alive in the form of a cash value in the plan, as well as long-term care assistance, and then money for you when you die as well. So universal life insurance has this plan has level premiums, and there's cash value feature as well to it. So it's there to help you, to protect you during both your working years and into retirement. Critical illness insurance can pay money directly to you when you're diagnosed with certain serious illnesses. So it can help with cancer, heart attack, stroke, major organ transplant, and there's a whole list of illnesses that it can pay you for. It pays a lump sum amount, and it would pay anything from $5,000 to $100,000 for the employee, and then spouses would be 50% if you choose to put the spouse on, and children would have 10% with that. And so that's there to help you. It can be used for expenses like co-pays, mortgage, rent, or childcare, or anything that you'd like to use it for, and it would help significantly in the event of a critical illness or cancer. With this plan, there's a health screening benefit. So each family member can receive an annual $100 credit for completing certain health screenings. It is predominantly for adults, but there are some cases where it would pay also for a child. And so this benefit, you would take the form into a place like CAREATC or to your doctor and have them sign it, let them know, and then it's $100 per person on the plan or per adult on the plan. The accident insurance would help you if there's an accident on or off the job. So it's there 24 hours a day to help to pay you if you have an accident, and there's a list of accidents there's a list of benefits that it pays to help you with that accident. So for example, if you were to be in the hospital overnight due to an accident, it pays you $2,000. For every day that you're in, it pays $400. So each thing that you would have happen that's on the list, it would pay a specific amount. Even if you died in the accident, there's $50,000 for the employee, $20,000 for a spouse, and $10,000 for a child. And this even includes that same annual $100 wellness benefit as on the critical illness. These benefits help cover out-of-pocket expenses such as medical bills, rent, groceries, and more. And they can be used for more than once, so it pays for each accident it would pay. And again, it has that $100 annual wellness benefit. There's also a legal club, and that helps you pay for traffic tickets, wills, home buying. The legal club has a comprehensive free and discounted list of items that it pays for. And it covers each family member, and the cost is only $14 per month. The legal plan, in addition, also has identity theft protection, where it helps to restore your good credit. It helps to restore your identity. It has insurance for if you do have a loss, and has preventive things it can help with. It can help with taxes as well. And then to sign up for any of the benefits that you just heard about, you would meet with the benefit counselor. And since you're listening to many benefits today, you might have questions about any of the benefits, and the counselors are there to help answer questions with all of the benefits. They can meet you face to face, or you could also have a consultation on the phone. They help to educate you and enroll you in the benefits. And the number that you would call to make an appointment is 844-231-1623. Thank you.
Finally, our financial protection benefit partners, VOYA Life, Cigna Disability, New York Life Disability, Nationwide Retirement Solutions, and Florida League of Cities.
Hello, and thank you for joining our benefits overview with VOYA Employee Benefits. Today I'm going to review the term life insurance benefit options offered by City of Tampa through VOYA Employee Benefits. This presentation is designed to educate you on the benefit options offered in this year's annual enrollment by VOYA Employee Benefits. Insurance is offered by VOYA Employee Benefits and is underwritten by RELIASTAR Life Insurance Company, a member of the VOYA family of companies. For specific pricing, provisions, and benefit options, please refer to your enrollment materials available from your employer. Term life insurance pays a benefit to your beneficiary if you pass away during the period of time you are insured under the policy. The City of Tampa offers basic life insurance and accidental death and dismemberment insurance at 1x your annual salary to a maximum of $150,000. This amount is provided at no cost to you. Accidental death and dismemberment insurance pays a benefit to you or your beneficiary, separate from the life insurance benefit, if you are severely injured or die due to a covered accident. You have the option to elect additional coverage called supplemental life insurance. During annual enrollment, you have the option to elect supplemental life insurance of $10,000 to $500,000 in 10,000 increments. For your spouse, you have the option to elect spouse supplemental life insurance of $10,000 to $500,000 in 10,000 increments. For your children, you have the option to elect children's supplemental life insurance of $5,000 or $10,000. If you elect children's supplemental life insurance, one monthly cost will cover all eligible children. Also included with your life insurance is an accelerated life benefit and waiver of premium. If you are diagnosed with a terminal illness with a limited life expectancy of less than 6 months, the accelerated death benefit allows you to receive a portion of your life insurance benefit while still living. The amount is equal to 50% of the face amount of life insurance in force, or $50,000, whichever is less. If you become unable to work due to a total disability, waiver of premium will allow you to continue your life insurance without premium payment. An additional service available to all employees with life insurance includes funeral planning and will preparation services through Everest. With this service, employees can receive advisor assistance with funeral pre-planning for themselves and eligible family members, as well as at-need funeral planning. Also, through an online tool, you can create customized legal documents such as a will, healthcare directive, and power of attorney at no additional cost. Also available to all employees with life insurance is VOYA travel assistance. Employees and their dependents can receive pre-trip information, emergency services, medical assistance services, and emergency transportation services when traveling more than 100 miles from home. Please visit the VOYA Travel Assistance website or call the Customer Service Center for more information on the services provided. Thank you for your time and attention today as I shared the benefit options being offered by VOYA Employee Benefits that are available to you during this year's annual enrollment.
Hi, and thanks for listening. New York Life is proud to offer long-term disability insurance to all City of Tampa employees. New York Life may sound like a new name to some of you. We were previously known as Cigna and were recently acquired by New York Life. So it's the same company, same people, just a new name. Your enrollment dates are September 20th through October 8th for long-term disability. So we'll just take a second to discuss disability insurance. Thank you. All right, so what is long-term disability? If you were to become injured or sick and couldn't work, this coverage pays a portion of your paycheck when you are disabled. Some examples would be cancer, any mental health issues, a long-term recovery from an accident, pregnancies, fractures, etc. So if you're not working and you don't have a paycheck, you can use this insurance to pay for things like your mortgage or your housing, your bills, your car, gas, groceries, etc. So the way it works is you have the option to select a plan, and we'll go through the offerings on the next slide, and it's paid for through payroll deductions. And then at time of claim or time of injury or sickness, you would file a claim with New York Life. And pre-existing conditions may apply depending on when you buy the coverage and when those conditions began. Next slide, please. So the City of Tampa plan has 3 levels available: 30, 50, and 60% of income replacement to a maximum of $10,000 per month. And the benefits begin after being out of work for 180 days. So typically, long-term disability begins when short-term disability ends. And employees can increase their level during open enrollment, 1 level per year. So if you're currently in the 30% plan, you can bump up to the 50% plan during open enrollment. Or if you're in the 50, you can bump up to the 60 without any medical questions asked, and that's only during open enrollment. So if you feel that you'd like to protect your income for these long-term disabilities, then you may do that during open enrollment without any medical questions asked. We also offer a value add program and service that we'll talk about in the next slide here. So anyone who's out on disability will receive 30 days of prepaid expert money coaching. So if you're out of work and you have to adjust to a new income level, there's a lot of challenges that come with that. So we offer 30 days talking to an expert, figuring out how you're going to pay your bills. And after 30 days, that service would end unless you opted to continue with it, and that would be at your own cost after the 30 days. We also offer identity theft prevention services and will preparation tools and resources. Among other legal documents and services, you can access any of these by calling that number on the screen, 888-724-2262. Thank you.
Who is ready to retire? My name is Jeremy Button with the Florida League of Cities 457 Deferred Compensation Retirement Plans. We are one of your 2 deferred compensation plan providers for the City of Tampa. Deferred compensation is saving your own money from your paycheck for retirement. The Florida League of Cities has been around for a long time. Next year will be our 100th anniversary. This retirement program was started almost 40 years ago. We have third parties oversee the plan and the investments as a way of watching out for the employees that participate in our plan. We partnered with Vanguard Investments. They have a great reputation and are one of the largest mutual fund companies in the world. 18 of our retirement plan investments ranked in the highest 1/3 of all investments. When do you want to pay taxes? Well, obviously the answer is never, but taxes are part of life. Traditional pre-tax contributions get you tax savings now, and then later you pay taxes when the money comes out. Roth after-tax contributions allow you to pay taxes now, then later in retirement you can get the money out tax-free. There are some great ways to engage with your account online. Financial wellness education resources were added this year. In your account online, you'll receive recommendations of educational videos to watch. You can change contributions at any time through Oracle, but now is the easiest time as you may be also changing your other benefits. Experts recommend saving for your own retirement and increasing contributions each year, but it's difficult. If you are in your 20s and drink 1 less coffee out a week, you could have an additional $50,000 or more in retirement. If you are in your 50s, 1 less coffee out a week, and you could have an additional $5,000 or more. Even that amount can still go a long way to help pay for increased healthcare costs in retirement. You can have money in both 457 deferred compensation plans with the City of Tampa, and you can transfer money between the plans, but you cannot actively make contributions from your paycheck through Oracle to both plans at the same time. Keep in mind, if you are new to the city, I would be more than happy to help you roll over or transfer your retirement plans from your past employer free from taxes and penalties. Usually this helps you keep track of your retirement goals more easily. While you are still employed, you have 2 ways to access your money: loans and unforeseeable emergencies. Reach out to me for more details. Through Vanguard Retirement Funds, Target Retirement Funds. We help you invest properly for your age and protect your money as you get closer to retirement. Interested in learning more? Set up a virtual video meeting with the link on the intranet to make sure you are on pace for reaching your retirement goals. I would love to go through the My Forecast tool with you to help you understand how to reach those goals. Not much for a video chat. We've got some great additional resources on our website that can help you learn more about retirement. Another good annual reminder is to keep your beneficiary up to date. I can help you set them up on your account online as well. Planning for retirement does not have to be as hard as you might think, and the Florida League of Cities can help. Thank you very much.
Hello, and welcome to the nationwide section of the City of Tampa 2022 Open Enrollment Year. My name is Denny Davis, and I have been the local retirement specialist in the City of Tampa for 13 years. And Nationwide has been a provider of deferred compensation in the city for over 35 years. What I would like to take some time today to do is talk to you about deferred comp and why you should be interested in it and what it can do for you. First of all, the pension you will receive from the city and your Social Security benefit may not be enough to retire with and replace the income you are currently earning, or even close to it. So deferred comp is here to provide another bucket of money to access when you retire. There are two different ways to save money in the deferred comp plan. You can save money pre-tax, which lowers your current year tax bill and allows your money to grow tax deferred, paying taxes on the money later when you withdraw it, hopefully at a lower tax bracket. The other option is to save after tax, like a Roth IRA, and you don't get a tax break up front, but then your money does grow tax-free. All contributions and account growth are withdrawn tax-free. If you do save in the pre-tax option of the 457 plan, the unique characteristic of this plan is that the pre-tax has no 10% early withdrawal penalty. So if you pull your money out when you leave the city and you are not yet 59 and a half years old, you would not incur a penalty, unlike an IRA or a 401k. When you have your money in the plan, there are several options on how you can invest the money. We have everything from a high interest paying fixed account if you are looking for safety. We also have a do-it-yourself option where you can research the various fund options and build your own portfolio. Finally, we offer our managed account service, which we call Pro Account. If you would like a professional money manager to handle the investing for you, that is available. They would have you complete a questionnaire to determine the type of investor you are, and that, coupled with your age, will guide them in building and maintaining a portfolio for you. You are also able, in the city's plan, to change your contributions at any time in the Oracle system. You may increase or decrease contributions. You may also contribute to both the pre-tax and after-tax Roth options at the same time. Finally, I would like to talk about the My Interactive Retirement Planner, which is a comprehensive tool available on the Nationwide website. It pulls together all your retirement information about Social Security, pension, deferred compensation, and outside investments to help you plan for a monthly income in retirement. The planner already has the City of Tampa pension calculator built into it. All you need to do is enter your years of service, your current salary, and your projected years of service at retirement, and the planner will help you determine what your income could look like from all sources in retirement. I appreciate your time. Thank you, and have a great day.
This is Dave Blazewitz again, and I'll be wrapping up the presentation for you. As in past years, the city offers extensive resources to assist you. Besides this presentation, we offer enrollment through Oracle Employee Self-Service, a robust open enrollment website with details and resources, and the 2022 Benefits Guide, which provides a summary of all city benefits and is a useful resource throughout the year. In closing, this slide provides direct links to submit any questions you may have or to reach the open enrollment website. And both are accessible from any PC, laptop, or from your tablet or wireless phone. If you prefer to call, we're including a number to reach our benefits team. The City of Tampa HR Department, our benefits team, and all of our benefit partners appreciate your attendance. Have a great day.